Hi, I'm Matthew McFarland. I'm a healthcare consultant with 21st Century Home Healthcare, and some of the benefits that really stand out with hiring a consulting agency would be just the first off, peace of mind. There is a lot of complexities that go into opening a home healthcare agency, and a lot to be distracted by as you go through and look at all the different pieces that need to come together to open a successful agency. Well, essentially when you think about the complexity, that's kind of the key word when you're opening up a home healthcare agency in any state. That's the first thing that folks run into is the complexity, and they're overwhelmed by how difficult it seemingly is to open it. The state, it seems like it's just too difficult to open. The license applications are so long. The policies and procedures, they have no idea. They can't write these policies and procedures, so where do we get them? There's just a lot that goes into it, let alone just getting your LLC or your NPI number or all the other pieces that you need to put together to make it happen. Complexity is the key word. So that's, the consultants come in and just smooth all of that out. We're able to help you navigate and prioritize and put these things and do them in order so that there's a flow to it, and we can have a timeline and just give you some organization and a roadmap. So it's really important as opposed to just kind of stumbling into it and running head into all those complexities. Something to consider is the regulatory requirements. There's state regulations and federal regulations. So your policies and procedures, if you follow them and you understand them, then you're going to satisfy both those state regulations and the federal regulations, and you will limit your liability long-term by doing this. Knowing a little bit ahead of time of what those challenges might be is very important as you're going through the whole process. Because again, when we talk about developing a marketing strategy and just that business plan and following that business plan, if you can see some of the roadblocks that might be ahead, that's going to be very helpful. So, a lot of what we see are business roadblocks, for example. We see a lot of folks get involved and they have a passion and a heart for caregiving, but they haven't done their due diligence on the business side. So when they look at, provider enrollment like Medicaid, for example, you can find out ahead of time what your strategy is going to be. Are you going to do Medicaid? Are you not going to do Medicaid? Are you going to do both? Are you going to go for private pay and Medicaid? And knowing these things ahead of time will prevent some heartache down the line where you all of a sudden you're not sure which way to go, right or left. Instead, doing that ahead of time, well, again, it goes back to planning, I think, is going to be when we talk about insights that can be shared and giving you the edge in the market, there's two things. It's planning. So the planning piece and getting ahead of anything that you can, be it marketing, be it just the business plan, be it taxes, be it any of these things we can get ahead of by planning, that's going to be key. And then, developing that marketing plan is going to be helpful. But having everything else from a compliance standpoint squared away too that you don't have to think about. So having the consultants come in and take care of all of these regulatory items, these compliance items, your state survey, that's going to free up time for you to focus on caregiving. That's going to provide a lot of just freedom for you to think about your vision and your goal and where you want to go and your passion. And you can see your dream of opening a home care agency really come to fruition, and it can be an enjoyable process.